So if you want to turn your cameras off, that's fine, and we'll turn it off at the end for when we start asking our Q&A. So I think that's it. We're all ready to start. Next slide. So it's just general. Put your hand up if you have any questions, but if you want to put any in the chat, that's fine. We will go through a Q&A at the end, so if you do have any questions, we might answer it as we go along. And that's it. So next slide, please. We'll go through the objectives of today's session. So we're going to understand what GP CPCS is, the referral pathway for general practice, understand the types of patients which can be referred into it, and the team members who will be making the referrals. We'll go through the GM protocols and escalation processes. We'll give a bit of an update about the practice go live dates and when those will be going out when you've got all your practice members trained. And we'll go through how general practice and community pharmacy will work together with the rollout and the referrals. Next. So I'll just give a bit of a brief overview. For some of you might have seen it already, because I know we've done quite a bit of engagement events at your meetings and things. So for people that don't know, it's the GP community pharmacy consultation service. It's a pathway for general practice to use for patients with minor illnesses or low acuity conditions, and they'll be referred into a community pharmacist. They'll be electronically referred to receive a consultation with a pharmacist. So that'll be a proper consultation room, and it'll be a proper clinical assessment where they'll have access to the SER, use NICE guidelines. So it's not like the minor ailments scheme that we have at the minute. Only patients that are electronically referred will be able to access this service. And then obviously the background is that the NHS CPCS is already nationally commissioned and funded and has been going through NHS 111 since October 2019. So the referrals made from 111 were made to community pharmacies for patients with a minor illness or those needing an urgent supply of medicine. And then the pathway has been expanded to include general practice into this, been piloted end of 2020, and the service was agreed to go live from the 1st of November 2020. And we're just getting around to the GM rollout now in Manchester. So next, please. So this is just the evidence and impacts from our pilot, the pilot that was done. And it's not GM just yet, but there will be more up-to-date information as we progress. So this is just from the pilots that were in different parts of the country. So 88% of patients in the GP pilot were advised or treated by a community pharmacist, 10,500 patients per week, which saved £20 million of appointments and consultations, which is around 6%. So I always say, like, it doesn't sound like a massive number, but actually that's quite a big potential of saving you appointment times for those minor illnesses. And there's 332,000 referrals, which I imagine the number is a lot higher now. And the pathway has been successfully piloted, and now it's rolling out across other general practices in GM and hopefully soon Manchester. Next one, please. So just go through the benefits. So obviously we're still going through COVID. Everyone's really busy with vaccine programs and rollouts, and we're just seeing that general practice is getting busier and busier, and it's about using those resources wisely and making sure that the patient's getting a good service, but in the right place at the right time. So if we can refer those patients safely to community pharmacy, then that's sort of a win-win for everyone. It'll increase the capacity within general practice, and then treatments for patients with higher acuity needs will be getting seen quicker by the GP in theory, and hopefully that will support that. It'll support the local NHS system and have an impact overall, and I'll just go through the individual benefits for each. The slide's frozen. Esther.
Has it? Which one are you on now?
Can everyone see benefits? Yeah. No trees. I don't think the slides have frozen. It might be your connection.
We will send a copy of them
okay.
after. Is it working? Perfect.
Yeah, perfect. Thank you. So I'll just go through the benefits for patients. So obviously they're getting an accessible and professional clinical service from a pharmacist of their choice. So it's the patient's choice which pharmacy they want to go to from the ones that are signed up. It'll be sort of re-educate the patient to go to the most appropriate healthcare professional, so that if they might get treated once in a community pharmacy, then they might think, oh, well, I had a good service, I'll go there again. So it's removing that need for general practice for the really minor conditions. Obviously for general practice, we want to create more capacity for GP appointments, and make sure that the patients are seen by the right healthcare professional at the right time. And it's also about building those relationships between community pharmacists, yourselves within that PCN, and that in turn will have a better impact on the health of the local population. For pharmacy, it allows them to demonstrate their clinical knowledge and expertise for patients with minor illnesses, and it also builds on their relationships with yourselves, and it's a cost-effective use of NHS resources, as I've said before. So I'll just go through the referral pathway. So this is all about like who, when, and sort of the how to. And I've got a bit of a video as well to share with you. So the first step is identifying which patients can be referred. There's got this resource that we'll share with you all. It'd be really good if you sort of printed those off prior to going live. We could have it dotted around where the receptionists sit and make sure that everyone's aware of the sorts of conditions that can be referred and the ones that can't be. The major thing is obviously it's only suitable for patients over 1, and there's a couple other things that we would suggest that you ask when you're on the phone to the patient. So how long have they had it? Have they tried to treat it with an over-the-counter medicine before? General things like that, and then that will help us to identify whether that patient is then eligible. So it will be the care navigator or receptionist that will be taking these phone calls, or the online triage system. They might come through there as well, and then they'll be going through the pathway of which way and how to do it. So on the next one, we've got actually making the referral and how that's done. So I don't know if anyone's already seen the Patient Access Connect template. It might have come up at some of your practices already. It's not live yet, but it's a really easy way for the referrals to go through. So when you're on the phone with the patient, you'll go through all the if the patient's this old, how long they've had it, and then there's this template which we can go on, and it will pre-populate the patient's details that we'll need for the referral with EMIS, so it connects together. So we're using all this data will be pre-populated. Esther, go on, are you gonna say something?
No, not at all. Not at all.
Okay. So where was I? Yeah. So the referral will go through to the pharmacy as an electronic message, and that'll be created by the general practice. It's really easy, like I said, and it'll make a bit more sense when we watch the video about how that's done. When we click on, all these are pre-populated, and then you just free type the condition and the presenting symptoms. And then I think Esther's going to go through the next part of it, so I'll pass it over to Esther.
Thank you very much. Hi, everybody. So just following on from where Lauren's taken us to there, so we've now identified that a patient is suitable to be referred, and then we've got a couple of options available of how we make that referral. And as Lauren said, we're going to watch a short video in a minute, which will just take you through about 4 or 5 minutes, just showing you the system in action. Now, there's a couple of options for you. You can either create a referral or you can assess for a referral, and that is totally down to practice choice, and it may even be down to individual person dependent on your confidence level. So the difference is that if you use create referral, you're going to get very limited support from the system. So this may be more suitable for people who are triage trained or have a clinical background. It will just ask for you to type a free type box with some information on the patient's presenting symptom. The information will pre-populate from the patient's record, as Lauren explained a minute ago, but the actual triage questions are very limited, but you'll be able to use that red and green table that we saw a minute ago to support you with that decision. The other option is assess for referral, and which gives you some additional triage questions. So what that will do is it will ask you a few kind of troubleshooting questions. So is the patient over 1 year of age? And then it'll ask you to make sure that to see if they've had any COVID related symptoms. And then it will allow you to select their presenting symptoms from a list. And then it will ask specific questions that will help you to define whether or not that patient can be referred to community pharmacy. So it's a bit more of a backup. It will provide a little bit more confidence, and it will highlight any red flags. So if something can't be transferred to a community pharmacy, it will let you know. So one of the things that we will ask you to do after the session today is to have some kind of conversations with your practice teams. And one of the things that you'll need to be really clear on is which one they would prefer you to use when making those referrals. So as Lauren said, we're just going to show you this short video now, which didn't work for us yesterday, but looks like it will do today. So would you mind just giving me a thumbs up, Lauren, if the sound's working all right?
The Patient Access Patient Signposting app is a new tool integrated into EMIS Web to allow joined-up referrals into Pharm Outcomes as part of the Community Pharmacist Consultation Service, CPCS. To use the Patient Signposting app, log into EMIS Web in the usual way. When you use Find a Patient to select a patient record, or when any of the care record options are opened from the Quick Launch menu and a patient record is selected, the app becomes visible here. The Signposting app is made available at multiple points during the patient's journey so that you can refer a patient easily at any appropriate time. Clicking on Patient Signposting opens up the app in a new window. The patient and GP details appear at the top of this page. Click Create a Referral to begin the referral. All of the patient details will be populated from the information held in EMIS Web. A Notes field is available to add any clinical information, such as the presenting symptoms and reason for referral. Click Continue and you will be taken to a page where you can select an appropriate pharmacy to refer to. The patient's home postcode appears in the search box. Click the search button to display a list of the closest pharmacies to the patient's home address, or you can search an alternative location, for example near to the patient's place of work. Select the preferred site and additional information such as their address, a map of their location and opening hours appears. If the patient confirms their selection, click Send a Referral. You will see that the referral has been successfully sent when this confirmation message appears. Patient advisors can access the Patient Signposting app directly from the appointment book. Patient advisors should click the Assess for Referral button on the Minor Ailment Service to identify patients who can be safely referred through CPCS. A series of triage questions, written and peer-reviewed by GPs, allow the patient advisors to safely identify the appropriate patients for referral. Once the triage questions have been answered and the patient determined as suitable to refer, the pharmacy choice page appears as before. The chosen pharmacy is notified of receipt of a referral into their Pharm Outcomes system in the following ways. The pharmacy will receive an email to inform them that a CPCS referral has been received. If the pharmacy has a Pharm Alarm device installed, it will start to flash. All incoming referrals appear at the top of the services screen in the Outstanding Referrals section. The pharmacist received details of where the referral has come from and the date it was sent. The patient details appear at the top of the referral form, along with any notes made by the referrer. The pharmacist is then able to complete the referral form. The presenting complaint is recorded, and links to the appropriate NICE clinical knowledge summaries appear to support clinical decision-making. If the patient requires escalation to another service, information on the appropriate pathways appears. If not, a symptom check and any actions taken are recorded. The consultation outcome is then recorded, which may include appropriate advice given, the supply of a medicine by over-the-counter sale or under a local minor ailment service or PGD, or that the patient was signposted or escalated to another service. Incidents such as urgent patient escalations can be reported directly to the CPCS commissioners from within the service using this message box. When the record is saved, a notification is sent back to the referring GP surgery that includes the pharmacist's details, patient details, consultation details and full outcome, and any medicine supplied if this applies.
Okay. So just a couple of things to note before we move on to a bit of a summary of that video is that the referral is being sent to a pharmacy of the patient's choice. So it's really important when we're sending them that we're not directing these referrals. So as it said, the patient's home postcode will pre-populate and it'll bring up the closest pharmacies to their address, but that can be changed to their work address or, you know, a family member's address, whatever is best for them. And it will show you the pharmacies that are close by. Once the pharmacy is selected, it will also give you details of their opening hours. So something just to think about is obviously if you're sending it, you know, last thing in the evening and the pharmacy is closing, then that's not going to be picked up till the following day. But we will go through some GM agreed processes in a little while. So as it said, once the referral has been received by the pharmacy team, the pharmacist will have a personal consultation with the patient. So that will be done remotely if that's appropriate, or if it's required, clinically required, then they'll invite that patient in for a face-to-face consultation. So that's a really key thing to note in the difference between this service and minor ailments. A minor ailments service is a patient assessment carried out by a member of the healthcare team under the supervision of a pharmacist, whereas this service is a personal consultation with a pharmacist, and as Lauren said earlier, with access to their clinical knowledge summary and summary care record as well. The outcomes that the potential outcomes are listed on the screen in the little bubbles. So that includes advice only, a referral into a minor ailment scheme, or an escalation to another service, or a referral back to general practice. Now, so far in the referrals that have been made in the live practices, 94% of those referrals have been dealt with by the pharmacy team with no further need for escalation. So hopefully that will give you a little bit of confidence that they're not all going to be sent back to you. Obviously, again, that assess for referral will support with that because it'll make sure that we're asking those kind of triage questions before sending the patient to community pharmacy. The other thing just to note is that once the consultation has been completed, you will get a notification of the consultation outcome. So again, a difference with that from the minor ailment scheme. Minor ailments, there is no records back to general practice of that patient assessment. With this, it's a full detailed PDF that will be returned to your practice teams. Okay, so there's a bit of an overview here of the process just to highlight some of the arrangements we've agreed for Greater Manchester. So because this service is national, we've tried to make it as consistent as possible across the practices and pharmacies within Greater Manchester. So we've made some kind of local agreements, such as once the referral is sent from the general practice team to the pharmacy, we're telling the patient to wait for contact from the pharmacy team. Now, those of you who are kind of au fait with NHS 111 referrals via CPCS will know that the patient makes contact with the pharmacy. The reason we've chosen to do it this way round is because, sorry, can I just ask if you could just go on mute? Because I can hear quite a lot of noise in the background. Lauren, can you by chance mute the attendees? Thank you. So we've asked for the pharmacy teams to contact the patient because it means that they can contact them.
Sorry, Esther, I've accidentally muted you as well.
No apologies necessary, thank you. So sorry about that. So the reason we've asked for the patient to wait for contact from the pharmacy is so that we can ensure the pharmacist has enough time and the right amount of time to deal with that query, and that they're not going to be rushing through to get through the consultation. It's really important they get that personal time with the pharmacist. So the pharmacist will make contact with that patient at a time within 2 to 3 hours of receiving that referral. If the patient doesn't receive any contact from the pharmacist, of course, they can get in contact with the pharmacy team. But again, you know, we are working as part of a working group to ensure that these referrals are monitored and that they are picked up within the agreed timeframes. The other thing that we've agreed for Greater Manchester is that there's a 2:30 p.m. cut-off time. So we expect that all pharmacies that receive a referral before 2:30 will pick it up on the same day. If it's after 2:30, it may still be picked up the same day if they have capacity to do so. However, it may be picked up the next working day. Now, again, we expect the pharmacist to use their professional judgment to decide whether or not that patient needs to be seen more urgently. But the reason that we can put that cut-off time in is because these are low acuity and minor illnesses. There isn't any reason why it should be too much trouble for the patient to wait till the following day. And then it just mentions at the end there that if it's after 2:30, it might be the next day. Something just worth thinking about is if it's a weekend or a bank holiday. Again, when you are selecting that pharmacy to send that referral to, it's worth just having a look at their opening hours, because we may just need to manage the patient's expectations. Okay. So we've just got here a bit of a flow chart to show you the difference between if you receive a referral via telephone or if you use a triage system, which we're aware that a lot of your practices do. So this first light blue one that's going down shows what we do if it's a telephone request. So we'd receive the request from the patient and you're on the phone. And what you would then do is, whilst on the phone to the patient, is have a look at that supporting document, the red and green list of symptoms, to see whether or not this may be suitable for a referral via GP CPCS. If you identify that it might be, then whilst you're on the phone to the patient, you would then go on to that assess for referral or create referral and actually carry out the referral whilst on the phone. That means that the patient can give consent for you to refer them to a pharmacy of their choice, and that we can send that electronically all in one go. If you are using a triage system, it's exactly the same process. The only difference will be is that you won't be on the phone with a patient already, so you will need to gain consent from them. So what we'd suggest is there's two lines here. The first one is for text messaging. The second one is for a phone call. Now, at the moment, text messaging is not set up for Greater Manchester, so we're just going to ignore that for now, and we will obviously update you if that comes in the future. So what would happen is you'd receive that query via your triage system. You'd have a look at your list of symptoms to see whether or not it might be suitable, and then you would phone your patient to gain consent to refer them to a pharmacy, and then you would carry out the triage whilst on the phone to them then. Okay, and it's just mentioning there that once that's been completed, then that will be sent electronically to the pharmacy team. So we did mention that there is a potential outcome of GP CPCS is a referral back to general practice. And as we said, this is quite limited, but there is a possibility. So we've got two agreed processes for Greater Manchester for non-urgent escalations and urgent escalations. And ahead of the training today, we've been in contact with your individual practices to confirm how they would like us to communicate those back to you. So that'll be either via telephone or email. So again, one of the things to go back to your practice teams with after today is to make sure you're clear on what those processes are for your practice. So if it's non-urgent at the end of the consultation, then the pharmacist will have a conversation with the patient to explain that they may need to see their GP. And they will phone or email the practice team to either arrange an appointment or to explain that the patient may need a follow-up appointment, and the practice team will then contact the patient directly. Now, there's a couple of things that we've made really clear to pharmacy teams to make life as easy as possible for all of us and to make sure we're all on the same page. So the pharmacist should not set any expectations to the patient of any specific treatment or outcome of that conversation. They should also make sure that the patient is aware that the general practice team will be in contact with them if that is the agreement that you have made. Obviously, if they've made that appointment whilst on the phone then or via email, that's great. But at the moment, the majority of cases, it's a conversation with the practice team, and the practice will make contact with the patient to proceed accordingly. The other thing that's just to note on here is that we've explained that there'll be a consultation outcome sent to your practice team once it's been carried out with the pharmacist, but there's also an option for the pharmacy to print out a copy of the consultation notes and hand them to the patient. So if that is something that you would like, then we can communicate out with the pharmacy teams ahead of your go live. Okay, the other option for your escalation is an urgent escalation. So this may be that a patient needs to see the general practice team quite urgently, or an out of hours service if we're out of hours. So this is exactly the same. The only difference is that it may be a phone call as opposed to an email, depending on what your practices agree, because it's slightly more urgent. Again, the pharmacist is not going to set any expectations. We can still print out the consultation outcomes, but we'd expect that the practice allocate a same-day appointment where possible, if that is necessary. Now, the other thing to note is there's also the NHS 111 healthcare professionals line, which we can refer patients to if that is suitable. And if it's out of hours, we've also got the option to refer the patient to A&E, or we can call 999 on their behalf. So we're just going to show you another brief video, and this is a virtual outcomes video for which we will send you a link after the training. I think we did send it in the pre-email as well. It's about a half-an-hour video, and it just gives a really brief overview of the service, and also kind of talks through some answers in your back pocket for how you can support those patients who may not want to be referred to community pharmacy. We are aware that you guys have good relationships with your patients, and you will know how to kind of get the most out of the conversation with them and use the right wording to support the referral. But there's just some key hints and tips based on the pilots that were carried out. So we're just going to show you those now.
We have now looked at how the service itself works, and I hope that you feel confident that your patients will be cared for in the same manner that they would be if they saw a medical practitioner in your practice. I now want to look at how you are going to convince Mrs. Jones that being referred for a consultation with a community pharmacist is the most appropriate action for the symptoms that she has contacted you about today. How you say it to Mrs. Jones is really important, as are the phrases and words you use. We will look at two different ways that you can say the same thing, and I want you to think about what you've heard on each occasion and how did it make you feel. Don't worry about writing any of these down, as they are on the resources page. Example 1. Mrs. Jones, I have listened to your symptoms today, and I suggest we send you to a community pharmacy. What do you think that Mrs. Jones heard and thought? The feedback from GP practice teams that I have trained includes the following. I'm being fobbed off. I want to see a GP. They're not taking me seriously. Alternatively, let's look at example 2. Mrs. Jones, having listened to your symptoms, I am sending you for a personal consultation today with an NHS community pharmacist. If you can just let me know which pharmacy you would like to go to, I can make the official referral now. What do you think Mrs. Jones heard and thought in this case? The feedback from the GP practice teams I have trained includes some of the following. They're taking me seriously. I'm going to have a personal consultation. I must be special. I can talk to someone today. It's an NHS service. That means it must be okay. So, by adding a couple of additional words, you have sent a completely different message. The GP practice teams I have trained were also clear that you don't ask Mrs. Jones whether or not she wants to go and see the pharmacist, hence the use of the word sending. Finally, a thought to leave you with. If you told Mrs. Jones that you were sending her for an X-ray at the local urgent care centre, it is highly unlikely that she would argue with you, as you are sending her to the most appropriate place to care for her condition. Sending Mrs. Jones to a community pharmacist for her minor illness follows exactly the same principles. That is, you are sending her to a medical expert who can appropriately care for her. However, we know that Mrs. Jones may still offer some reasons why she still needs to see a GP. Let's now look at some of those reasons and your potential answers to them. A list of these is also included on the resources page on the right-hand side of this screen, so that you can print it off and have it next to each of your colleagues as a reminder. When Mrs. Jones says, "If I go to the pharmacist, I won't get an appointment today," the answer is, "Mrs. Jones, if the pharmacist believes you need an urgent appointment, they will contact us." Mrs. Jones says, "I have been to the pharmacy already and they couldn't help." Mrs. Jones, did you have a personal consultation with the pharmacist where they went through the medicines you are on, etc.? The pharmacist won't know what to do. Mrs. Jones, pharmacists are highly trained professionals with 4 to 5 years training and spend a high percentage of their time helping patients with symptoms such as yours. I am not going to pay for anything as I get my prescriptions free. Mrs. Jones, The pharmacist will clinically assess you and will discuss the most appropriate actions to help you, which may or may not include a product. Finally, remember you are not going to persuade every patient with a minor illness to have a referral to the pharmacist. There will be some patients where you know it's not going to happen, and I'm sure you know who I mean. However, if you can move even 75% of your patients, you have just freed up more capacity for your practice. We have nearly come to the end of this training, and the final thing I want to cover is the following question you may have. Our practice is already very good at navigating / signposting patients to other services, including advising people to go to a pharmacy. Why do we need an electronic referral when we can just tell people to go? There are a number of reasons why it is better that you use this service and do an electronic referral. 1. By sending an electronic referral, you are ensuring that the patient is clinically assessed by the highly trained pharmacist. 2. The outcome of the consultation and any product supplied will be sent back to your practice, ensuring that your practitioners have the most up-to-date information and that you know the patient actually did attend a pharmacy and didn't just say they did. And 3. If the patient requires a referral back to the practice, this will be formally handled, therefore safely managing risk across primary care. And finally, 4. The pharmacist will get paid for the consultation, whereas if you already refer the patient, they won't.
Okay. So as we explained, we have sent you that link. We will send it again after today's session. It would be really beneficial to watch the whole 30 minutes if you haven't already. If you have, and we've just shown you that clip, I'm really sorry for the duplication, but it is really worth watching because it's got some really good hints and tips in there. So I know there's a lot of information we've gone through, and we will open the floor to questions in a minute. But I guess there's just a couple of things, as we've mentioned, that would be really beneficial to speak with your practice teams about before you go live. So the first thing is, how are you going to make this work in your practice? So thinking about those things that we talked about earlier, who's going to carry out the triage? How are you going to carry out the triage? Are you going to have everybody using Assess for Referral? Are some colleagues going to use Create Referral? Or is that dependent on confidence levels and previous training, I guess. And then the other thing is, where are you going to store that consultation information once it's received back from the pharmacy? It's going to be sent via your NHS mail accounts, whichever one you agree with us before you'll go live. We haven't got to that point just yet, but we will confirm with you ahead of time. So what are you going to do with that information once it's been received? After today, one of the things we said on the objective of the session was that we'd go through go live dates. Now, unfortunately, we haven't got an exact date for you for going live, but we do know it will be over the next couple of months. We're hoping that August will be well, August is next week, but we're hoping that into August you'll be able to go live with this. We are working with EMIS to get you enabled as soon as possible. As Lauren said, some of you might have the buttons on your screen already. You won't be able to do anything with it at the moment. You can click it as much as you want, but it won't actually do anything. But we will let you know when it will be done. We will be making We will be making contact with all the pharmacy teams, especially the ones that have more than 1% market share of your dispensing for your practice, to let them know, firstly, when you'll be going live, so they can start actively checking and completing referrals. And also to let them know what your non-urgent escalation process is, whether that's phone or email, and the same for your urgent. That just means that we can make sure that everybody's using the right processes from the start. Now, important to know, as we said, we'll be monitoring those referrals, and we will be looking out for any deviation from these processes. So, throughout Go Live, we will be supporting you, particularly the first 4 weeks. So there'll be somebody available for your whole Go Live day when you first start making referrals. You can call us anytime. There's many of us, isn't there? There's Chrissy, Lauren, there's myself, and there's other members of our working group. But we'll also be supporting you by sending regular updates over the first 4 weeks with any issues that have been raised from practice or pharmacy teams to work through those together. Again, we just mentioned the NHS email address. We will also be getting in contact with you to confirm which address is the best for you to receive those consultation outcomes on. So we'll be in touch with you individually in due course. we will move on to questions in a minute, but we are really keen to improve these sessions as much as we can for future events. Obviously in Manchester we're doing things slightly differently, so we're working with MHCC to deploy at scale. So I think we've engaged with 13 out of 14 PCNs in Manchester, so it's been really brilliant, and we're so grateful for the interest from your practices. But we'd really like, if possible, we'll send you a link to this form after the event. And if you do have a few minutes just to fill it out, anything that we could improve for next time, anything that was particularly good, we'd be really grateful. We'll also be including a copy of these slides in the email we send you after today's event, and it has got a number of resources available for you. So there's the training videos that we've watched today. Again, the virtual outcomes one is a bit longer than the clip that we showed you, but the patient access one is about 4 or 5 minutes. There's a link to the NHS BSA page for CPCS and details of the service specification, some frequently asked questions, and then also there's some virtual outcomes training. So there's some resources in addition to the video that we've just watched for your reference. Okay, so I think at that point, after feeding you a lot of information, we will open the floor to any questions that you may have, if that's okay. If anyone doesn't feel comfortable speaking up, please, by all means, pop them in the chat box and we'll get to them. Silence.
No. Do you want to stop the recording in case anyone's
Good idea.
any questions?